here are our stretches that I like to have parents do for just babies with tension. And this little guy is doing much better after his first visit, but we're still working through some tension. So the first thing in this position I like to do is just knees to chest. We're just bringing the bottom up a little bit. Are you gonna fill your diaper, little guy? That would be fine. Just bring the bottom up a little bit. Then we can do some arm stretches. So I put a hand here, and then we're stretching upward. This is really not an issue for him, but for some babies, this is a real challenge where those arms and shoulders are really tight. So if that is a challenge, I do that about 5 times, very gently. I'm gonna walk through a series of one set of stretches, and so I will let each parent know how many times a day we should do that one set of stretches. See how easy that is for him. That's what that should look like with good arm motion. Like I said, some babies really struggle with that, where we just want to stretch upwards about 5 times. Okay, then we're going to turn you over and do the stretches on your belly. Oh, bless you. Bless you, bless you. So we'll put baby on their belly for this set of stretches and just see wherever he wants to put his head. Make sure he's got a little breathing room. Hey, buddy. So the first thing we want to do is the hip jiggle. And so I always tell parents you can't do this wrong. Once you get the hang of it, it's really pretty simple. You take the baby's hips in your hands and you're just doing a back and forth motion, just like this. And you're just going to see what he will tolerate. I'm waiting for him to relax. There we go. And he's like, oh, that kind of feels good. And we're just shimmying those hips. Shimmy, shimmy, shimmy. Yeah, and you just listen to what they will tolerate. Yeah. Okay, okay. And then we're going to take a little break. Yeah. You're okay. So, and then we'll show the rest of the stretches on the belly, if he will let me. We can do knee to chest. This is a good one for him because that's a little tight for him yet. We're trying to get his knee up towards his belly. He's really not, there we go. He's not really into that at the moment, but we're aiming for that. Knee to belly. And then we can also pull the leg backward, gently stretching backward. But like I said, we only do what he will tolerate. When we're, hey bud. When we're in this position, we can do this stretch where we take his bottom in our hand, we pull forward. This is a lot looser than he was last time, but still a good one for him. It's just pulling him forward, because lots of babies are too tight and backward. So we see lots of babies who have too much tension pulling them backward, and so these stretches are designed to help relax all of that tissue. So we want to bring him forward. Yeah, you're doing such a good job. You're so patient. So that's a great one in this direction. And if he'll let me, we're going to do a couple sitting up as well. This is another good one for him. We call it round the world. We just do a round like this. I'm supporting his head. I'm just seeing what he thinks. We just do slow circles. This is also good for an upset tummy. This will also often help baby get some gas out. Do both directions 4 or 5 times. Around the world. And then again, for a baby who needs some arm stretches, we can do them in this position as well. He's pretty good at this, but it doesn't hurt to pull up on the arms like this. Seeing what he'll let me do. Just like that. Yeah. Like this. Just like that. Yeah, it's so easy for him. Yeah. And then the last position we'll do is on my arm. So we turn baby upside down. And hey, bud. Sometimes I will recommend that we do this. If he's having a trouble turning his head to one side, we'll recommend that the parent hold them with their challenging side. Like, so if he was having trouble looking to his right, this would be the side I would hold him on to help him look to the right more. And so just holding him like this for a while can help to stretch that to the right. And then in this position, we can also add a little bit of this stretch where we're pulling him forward. Pull forward 4 or 5 times. And then another one, if we have a fussy tummy, this would be another good one for him. I can't remember if I showed you this. We can do a little bit of a belly massage in this position. We're going to take a couple fingers, find his ribs. Here's his bottom ribs right here. And we're just going to pull downward while I'm bouncing with him. So just pulling downward like that. That's about as much pressure as I use, and he's really enjoying that. If he was bracing or crying, I would stop. But just 4 or 5 times pulling downward like that can help the milk go in the direction that we want it to.